gastroenterologist and hepatologist at Houston Northwest Medical Center Hospital, and we'll talk about the colonoscopy and the reason for doing this procedure. Purpose of performing colonoscopy is to examine the large bowel, that's the rectum, colon, and terminal part of small intestine. The procedure is performed by long flexible telescope, which is about 1.5 meters long and about 1 centimeter in diameter. It's important that the patient is prepped so that entire colon can be checked. In order to achieve that, patient has to drink some liquid to flush themselves out of any fecal material. Younger population can use tablet like a Visicol tablet, but still they have to drink a lot of liquid to make sure the colon is clean to its entirety. Patient comes to endoscopy discerner with his family member who has to drive him back. As the conscious sedation is used during the procedure, he or she cannot drive home on its own. Usually anesthesiologists use IV sedation, which make the procedure painless, and patient does not remember any pain or discomfort during the procedure. During colonoscopy, endoscopists look for any source of abdominal pain, bleeding, diarrhea, colon polyp, diverticulsis, colon cancer, or any other mucosal abnormality. Sometimes biopsy or mucosal scraping is performed to diagnose any cause of colitis like ulcerative colitis, Crohn's colitis, ischemic colitis, or infectious colitis. Specimen are sent to pathologists for tissue diagnosis. The colon aspirate can be taken during the procedure to diagnose any bacteria or parasitic infection causing diarrhea. The polyps are small tumors in the colon and rectum, and most of the time can be snared off during colonoscopy procedure. If the polyps are big enough and for some technical reason cannot be removed, then the biopsy is taken for tissue diagnosis. Large masses are also biopsied for confirmation of occlusion or inclusion of cancerous diagnosis. One can also see existence of any diverticuli in the colon. Most of the time, diverticulosis is a painless condition, but they can be inflamed and cause abdominal pain, mostly located in the lower part of the abdomen. During colonoscopy, certain other therapeutic procedure can be performed easily without old-fashioned laparotomy done by the surgeons. Colonic stricture can be dilated with the balloons. Flat polyps are injected at its base to raise it, and the polyp can be easily snared off. Bleeding site can be injected and cauterized to stop the bleeding. Internal hemorrhoid can be ligated during the colonoscopy procedure.